So welcome everyone. Thank you for joining us tonight. We're gonna have a lot of fun, I think, I hope. But one of the most fun parts for me is I get to share this talk with one of my favorite people to work with, Victoria Pena Cardinale. So it's especially fun for us to get to do this together. So tonight we're going to do some educational things, and then we're going to do some experiential things. So you're going to be able to walk away with actual techniques that you can use starting at time 0 to help you improve your self-care. It's a formal talk and it's on Zoom, so it's a little kind of hard to make it interactive, but if you have any questions in the moment and you feel like they can't wait, just somehow raise your hand on it and we'll try to answer it. And keep it a little bit casual. Again, we are going to be doing some actual exercises. We aren't doing physical, we'll leave that for Nancy, but we're going to be doing some of that. So get yourself comfortable and we're going to get going for tonight. Make sure you're muted. So first, I thought it would be helpful for us to, actually, if I can advance the slides, hold on. There we go. All right, so with Zoom lectures, I think it can get kind of strange because you're trying to look at slides and faces that are lighting up and getting voices, right? So I just wanted to, we had a lovely introduction from Maggie, so thank you for that. And I just wanted to put faces, names, and voices so that you can keep track of who you're hearing. So I'm Christy Weston. Again, I'm the Director of Outpatient Psychiatry. And Victoria, you're muted, my dear.
There you go. Okay, so I'm Victoria Pena Cardinale. I'm a licensed clinical social worker, and I'm the manager for outpatient clinical social work at Capital Health. My primary work is as clinical coordinator for the behavioral health program at Capital Health. Thank you.
Okay. So luckily we have very different voices, so you should be able to keep track of us. But before we get into it, I wanted to just say we have no financial disclosures, interest, or any affiliation, anything that we talk about, except for the fact that we are both employed by Capital Health. And I just wanted to do a little bit of an advertisement, I guess, not really, but the services for mental health in the outpatient world for Capital Health are through our practice, which is called Capital Health Behavioral Health Specialists. So if you're in need of any services, we're here and we're happy to help. We have 2 locations. We see patients in New Jersey in Bordentown on Route 130, and in Pennsylvania we see patients over in Newtown at 3 Pence Trail. We have psychiatrists like me, we have psychologists, and we have psychotherapists, and we provide a variety of services, including medication management, all kinds of psychotherapy, individual group, you name it. We have TMS, which is a special kind of treatment for depression, and we also work in integrated behavioral health with some of the primary care practices, Capital Health. In addition, one of the things that we do is mindfulness-based stress reduction. So we're going to be talking about that tonight. So I want to start the formal part of the presentation today by just doing some defining of terms. Okay, so first, it's called self-care boot camp. So what is self-care? I mean, it kind of sounds self-explanatory, but it's good to think about what it actually means, which is taking time to do things that help you live well, improve both your physical health and your mental health. So you probably hear a lot about self-care, read it, and but we're really terrible at doing self-care. We're really good at helping other people and giving of ourselves to others, but we forget to take care of ourselves a lot of the time. So it's really the idea of having an empty glass. You need to fill your glass back up. So you've got to nourish to flourish, like this little cartoon says. You have to put your own oxygen mask on before you can really do anything for anyone else. So that's self-care. And we called it boot camp. It's probably better if we would have called it basic training, because we're going to do some basic training trainings that will help you with your self-care, but camp sounds a little punchier. So this is your self-care boot camp. And as this drill sergeant is yelling at this recruit, repeat after me, self-care, it matters. So self-care is really important. And I hope, and we hope that you take that away from tonight. So other terms that we hear a lot about are, and we use actually a lot, are stress and burnout. You know, I think it's hard for a lot of people to say what those things really are, but we know it when we feel it, right? So you know when you're feeling stressed, you know when you're feeling burnt out. We actually have definitions for these terms and they're a little bit different. So I thought I'd start with just kind of defining what these two different things are. So, and this is a little out of order, but we'll start with burnout, because burnout usually comes from having too much chronic stress. But burnout really is the depletion or exhaustion physically and mentally because you're giving too much of yourself, right? So you're striving towards unrealistic things, either outside of you or inside of you, and you're just completely depleted. So I think a good way to think about it is when it comes into your mind to say, I'm done, I'm just done, that is being burnt out, right? There's nothing left in you physically or mentally that you can give to the world. And one of the things that is hard about burnout is that it's hard to even get out of it because you're so depleted and it feels like it's never ever going to get better. So burnout was first coined and given a definition way back in the 1970s, but it's definitely gotten much more common, especially, you know, over the last couple of years with the COVID pandemic. So that's burnout. That's like when you're done, there's nothing left to give. Stress is different. So stress is actually a biological response that we have that's adaptive. So we need to have a stress response so that our body and mind can get itself where it needs to be if there are any real threats to us or things that we really need to pay attention to. So stress is any change in your physical, emotional, or psychological self as a response to a perceived or an actual threat. Okay, so that's the fight or flight or freeze. We've added freeze to it. So fight, flight, or freeze. That's the stress. That is stress, right? And we all experience stress, and sometimes it's appropriate, right? So, you know, if you're out on safari and the lion is right in front of you, you want your stress response to kick in so that your heart starts beating faster and your pupils dilate so you can see everything and your muscles get extra energy so you can run away from the lion. What's interesting though is, you know, what often happens is we will get that stress response to things that really one wouldn't even consider stressful, largely, usually because of thoughts we're having or situations we're putting ourselves into. So ways that we can combat stress include changing the situations which are causing stress or changing the way that we process and react to those situations. Now I'm going to go bounce back to burnout real quick. So the people who are most vulnerable to being burnt out, meaning people who have chronic prolonged stress, are people who tend to put way too much of themselves out there to the world without taking the time to, again, fill your glass back up. So if you are someone who has a lot of people that you're responsible for, whether it's kids, parents, spouses, whatever, you know, you're always on, you're always trying to keep a lot of balls in the air. People who work in stressful situations. If you're someone who is very hard on yourself and tries to be a perfectionist, you are also at a higher risk for being quick to burn out. And if you're, you know, additionally, like if you're in situations where you feel like people don't appreciate what you're doing, you know, you can really feel burnt out, and that can be at work, but it can also be at home. So, you know, if you are someone like that, you are more vulnerable to burnout and stress than other people. So we thought it might be interesting to do our first sort of experiential thing right now. So I'm going to throw it over to Victoria. You got it, Victoria?
Got it. So are you experiencing burnout, or are you really just feeling the stress of day-to-day living at work, family, your day-to-day responsibilities? I think one of the most important things about this talk is that we're really going to focus on ourselves and really have an opportunity to look within and see how we're doing. So we would like to take this opportunity for all of you to take a short test, is really a burnout readiness scale, just to see where you fall under that, under those categories. And it might be that you find that you're perfectly fine, which is wonderful. Just keep doing what you're doing. Identify what is it that I'm doing that is keeping me very resilient. So identify those things so you can strengthen those. And if you find that maybe you're in the middle, then maybe strengthen those skills that you're probably going to be learning some new skills, I hope, or reinforcing some of the things that you knew, and kind of begin to do those a little bit more often. And then if you find that you're rating really high in the burnout scale, then maybe it's time for you to decide that maybe I can talk to someone about this. Maybe I can find a therapist. Maybe I do need to see a psychiatrist and be evaluated and determine what is the best treatment plan for me. So whatever the outcomes are, they're all good outcomes because they're raising awareness. And then with awareness, we can do something about it. So if we can open the survey, Dr. Weston, the survey, there you go. So if you have a piece of paper and pen handy, that's great. You can begin to write your answers as we go by them. And if you don't, that's okay. Just do an internal rating and just get a feeling of how you're doing. So these are going to be 10 questions. They're going to be rated from 0 to 5. 0 is I never experienced this. 1, very rarely. 2, rarely. 3, sometimes. 4, I often experience this. And then 5, very often I experience these situations. So it's okay if you don't have a piece of paper and pen, that's fine. Again, we can do an internal rating, and that is also good enough. All right, so number 1, do you feel fatigue in a way that rest or sleep does not relieve? Take a moment and rate yourself. It never happens, or it happens very often. Anything in between. Do you feel more cynical, pessimistic, or disillusioned about things you used to feel positive about? Never, or anything in between, very often. Do you feel a sadness or emptiness inside? Do you have physical symptoms of stress, like insomnia, stomach pains, headaches, migraines? Is your memory unreliable? Are you irritable or emotional with a short fuse? Have you been more susceptible to illness lately, like colds, the flu, food allergies, hay fever? Do you feel like isolating yourself from colleagues, from friends or family? Is it hard to enjoy yourself, have fun, relax, and experience joy in your life? And last, do you feel that you're accomplishing less in your work? So now all we need to do is to add those up, add your score. This is all information just for you. And then once you do that, take a look at the ratings. And if you score anywhere between 0 and 15, you're doing very well, which is great to know. If you score anywhere between 16 and 25, some attention is needed, and you might be a candidate to maybe get some help. But if you know some of the skills, or maybe you start using some of the skills that you will learn here today, maybe you can do that on your own and you can maybe find yourself doing better. 25 to 35, you're on the road to burnout. So it's important to make changes quickly. And then 36 to 50, you need action immediately. Your health and well-being are threatened without scaring anybody. These are all things that can be undone, which is the wonderful thing, that with the opportunity being given to us, we can get better from these symptoms. Okay, so just take some time and then you do as you think is necessary. So moving forward, so we've been talking about mindfulness. Dr. Weston began to tell us, about mindfulness. And so what is this mindfulness thing that we hear about all the time? Mindfulness is just simply awareness. It's just being aware. It's being aware of the present moment. What are we doing right now at this moment? Whether you're drinking a cup of coffee, whether you're listening to this talk, are you really listening? Are you able to stay in this moment? Is awareness of your thoughts, awareness of your body sensations, which we oftentimes don't even think about, as much as we need to. And then awareness can be cultivated in many, many ways. So yoga is one of those ways that we can do that. And we're going to have Nancy doing some demonstrations for us, which is great. We can do Tai Chi. I don't know if some of you may be aware of Tai Chi, but Tai Chi is a series of gentle physical movements or exercises, stretches. Sometimes people describe it as meditation in motion. And really all that means is being aware of those movements that you're doing. It promotes serenity through gentle movement. So that's a way to reach mindfulness. And then of course, meditation. So meditation is a practice that can help us find that mindfulness and that awareness, and is proven to be very effective through empirical research. Dr. John Kabat-Zinn, he actually created a program, 8-week base mindfulness stress reduction program to help people at the University of Massachusetts, the hospital at the University of Massachusetts, that were experiencing chronic pain and chronic disease or chronic illness, to find a way to find relief through mindfulness meditation. So he will be teaching people how to self-regulate their emotions, how to self-regulate their pain, through a series of meditations and exercises that will bring them to that level of awareness where they could self-manage all of the physiological symptoms or the emotions that having a chronic health condition or chronic pain could bring to any one of us. There are many myths about mindfulness. Some people, and so we want to kind of talk about what mindfulness is not. And mindfulness is not meditation. As I just said, meditation is a means to mindfulness. Mindfulness is about taking time out to rest and relax. A lot of people experience that when you are mindful, then you're just relaxed all the time. That's really not the case. Mindfulness is just the appreciation of the present moment without judgment. So really there is no particular end result for mindfulness. It's just a way of being. Some people believe that mindfulness is having no thoughts. That really is not possible. Our brains are created to think, and we actually have to make our brains not think in order to kind of achieve that moment. So it's not something that we naturally do. In a mindfulness practice, we're going to find awareness from one moment to the next, but it's really not a constant state of being, which is the next point. Mindfulness is joy. I have to say mindfulness can be joy. We can have joy when we're mindful, but it's also not constant. Sometimes when we create awareness and we increase our awareness, sometimes we have experiences that may not be joyful. Maybe through a body scan, which we're going to be experiencing later today, we might find that something hurts, something feels tight. That's not joyful. But having the awareness that is there, it gives us the power to do something about it. Mindfulness is religious. It is not. Mindfulness, is not a religion. And mindfulness is a fix for everything. We could only wish that was the case, but it is not. But it can be a tool for us to feel better, through awareness.
Okay, so I wanted to talk a little bit about some of the physiology that underlies how mindfulness actually works. So there is a real biological basis for how mindfulness can decrease our stress. So in order to understand it, we have to think about part of our nervous system that's called the adrenergic nervous system. And that part of our nervous system has two parts: the sympathetic nervous system, and that's the part that's responsible for fight, flight, or freeze. Okay, so when that part of our nervous system gets activated, we release a whole bunch of chemicals and stress hormones that cause our heart rate to go up. We start breathing more quickly. Our muscles get tense and ready to go. We get very aroused and ready to move or to attend to something. Our pupils dilate. So all these physical things happen when our sympathetic nervous system gets turned on. And again, we need that sometimes, right? If something bad's about to happen, we need to be able to respond to it. The problem becomes when that part of our nervous system is constantly on and constantly spitting out all of that stress hormones, stress chemicals. They have effects on our body, certainly, and they have effects on our mind. So the other part of the adrenergic nervous system is called the parasympathetic nervous system. And that part is the part that's responsible for our resting and digesting. So sleeping and processing our food and bringing everything back into equilibrium. So what mindfulness does is all of the things that promote mindfulness actually help turn on the parasympathetic nervous system, which again is in opposition to that sympathetic nervous system, and calms all of that down and brings us back to where we want to be. Okay, so this is the biology under it. So just to kind of review the stress cycle quickly, what happens is we're presented with some kind of event in our life. And then the next thing that happens is we have to decide whether this is something that's a threat or a challenge, if we have to turn on that sympathetic nervous system. And when we decide that we do, those chemicals get secreted and they get us ready to fight or flight, which we do, coming around the circle. And eventually, when the threat or challenge is gone, all those chemicals are depleted, and then we are completely fatigued and then have to have time to rest, to be in a physiological state to deal with the next stressor, right? So in this stress cycle, mindfulness can actually stop the cycle at various points. Ideally, when we're in a more mindful state, we assess events differently. So something that might seem like a stressful thing that we have to respond to, if we're in a more mindful state, we realize that we don't actually have to turn on that sympathetic response, right? So we can stop this cycle over here. We can stop it after we already decided it was something we have to respond to, and we have all those chemicals going around. We can actually dampen it all down by using mindfulness techniques to kick on the parasympathetic nervous system. So the benefits of mindfulness are many, and include that if we're in a more mindful state, our memory functioning and our attention are much better, especially attention, and we need attention to form memories. We decrease in our ruminative thinking. So ruminations are when we get it stuck in these thought patterns of going over and over and over the same things and never kind of get resolution. Usually they're things that cause us anxiety or that we're feeling anxious about. Mindfulness can improve your emotional regulation so that you don't react as much. You have time that you can respond to things in your world. And when we react, those are the times that we tend to get ourselves into situations we don't want to be in, or we respond in ways we actually don't really want to, we react in ways we don't want to react in. And mindfulness helps manage the stress, from a real biological standpoint by doing various things, including reducing our heart rate. It helps with our sleep functioning. It actually helps our immune system, because when we're stressed all the time, our immune system is not as good, doesn't function as well. And then it can also bring us a lot more satisfaction in our life. Because, and what I really want to, the real takeaway from what we're talking about with regard to mindfulness is about being in the present, which sounds kind of like, of course I'm in the present, where else would I be? Oh, we're usually in the future and the past when we have, when we're having thoughts that cause us stress, when we feel anxious and tense. Okay, so the question becomes, well, this is all great, mindfulness is great, I buy into this, but how do I do it? And so what we're going to talk about are different techniques, and we're going to go through them and teach you them to help you stay present focused. And so, and that has to be both our body, but also our mind, and especially our minds. Because if you think about it, how often are we really in the present? It's almost never. Right? So you're listening to me talk maybe, but you're also thinking about what you're going to have for dinner later, or something that happened yesterday, or some stressful thing that's happening later this week, right? So we're very rarely just focused on what's going on in the present. So mindfulness exercises help us practice staying more in the present. And truly, when you're focused on the present, everything else seems, you don't have all those stressors coming in from the future and the past, unless of course you're presently standing in front of a lion that's about to eat you, but that hardly is ever happening, right? So we're going to teach you 3 different general strategies, 3 different tools, techniques to help practice mindfulness. And as Victoria said, it is a practice. It's something that you want to do every day. It's good to set aside some time to do it. At some point, it will become second nature that you get yourself into a mindful state whenever you want to. So the 3 different things we're going to talk about in our section today are diaphragmatic breathing, the 5 senses exercise, and then body scans. And these are all things that you can do, that basically everyone can do anywhere, anytime. So they're really great tools to pull out when you feel like you need to spend a little bit of time on self-care. Okay, so I'm going to talk about the breathing. So what is diaphragmatic breathing? So that's a fancy name, or sounds kind of fancy. So the diaphragm is the muscle that separates your chest cavity and your abdominal cavity. Okay, so it's the main muscle that's important for breathing, right? It causes us to be able to inhale and exhale. So usually, if you think about it, we're usually sitting, and when we're breathing actually pretty shallowly, usually in the upper part of our chest. It's very rare that we're taking good breaths where we're filling up our entire lung capacity. So that's not something that we're naturally doing, but it's actually a wonderful way to help calm us down, turn on the parasympathetic nervous system. So diaphragmatic breathing, it increases your oxygen supply to your brain and your muscles. It turns on the parasympathetic nervous system, as I said, promoting calm and making you feel relaxed. A few minutes of doing this a day can bring you a huge sense of relief, but also give you renewed energy. So that's especially important if you're feeling totally burnt out. So it's nice to take a couple of minutes to do this. I often, when I'm working with my own patients, when they say, well, I just need one thing that you can give me to make me less anxious, just tell me one thing to do that'll help right away. And diaphragmatic breathing is that one thing. You can actually, if you do it well, correctly, you can actually basically put yourself to sleep in a few minutes. So we're not going to do that, hopefully, but if you drift off, that's fantastic. But I'm going to teach you how to do that in just a second. But first, I do want to mention the idea of breathing space. So again, how often do you during the course of your day think about your breathing? If you have a respiratory illness, obviously you're going to be thinking about your breathing more than the average person is. But most of us kind of go through the day not really thinking about it unless we're having trouble. So breathing space is really giving some time and space to focus on checking in with how you're doing, how stressed you feel, how tense you're feeling, and give yourself a little bit of a moment to do some nice, good relaxation breathing. Okay, some diaphragmatic breathing, and it really only takes a couple minutes a day. It can really help with things like insomnia. So when I'm having trouble falling asleep, this is the first thing I go to help me kind of quiet myself down and get myself into a place where I'm going to naturally fall asleep. Okay, so how do we do this? Diaphragmatic breathing, again, it's really you're going to focus on your diaphragm. So what I like to do is, I presume most of you are sitting, I hope. If you are, you can do it while you're standing or laying down, but sitting is, we're going to assume we're all sitting. So what you want to do is just sit back in your chair. So, scoot yourself to the back and rest your back against the back of the chair. And put your hands on your abdomen. Okay, so put them on your belly. When we're breathing shallowly, we're breathing up here. Like if you think about your shoulders going, we're doing these short little breaths up here. We're going to actually do big belly breaths. Okay, that's the diaphragmatic part. So when you inhale, your belly's going to expand like a little balloon. And then when you exhale, it contracts and goes back down. So just practice taking an inhale and having your belly rise. So your hands on your belly go up. And then exhale and your hands on your belly go down. And then you just keep doing that and practice breathing like that. So if you're a singer, you play a musical instrument, you might know how to do this. So breathe in, belly comes out. You can't see my belly. And then you breathe out and your hands come back in, okay? So it's easy to breathe in through your nose and out through your mouth, but it doesn't really matter. So you can do that just a little bit and practice the actual physical sensation of breathing like that. And then to give yourself time and space, a nice little exercise is something that we call box breathing. So box breathing invokes mindfulness because you're going to be imagining, so there's a little box here, you're going to be imagining a box. So you want to put your focus either on the box or actually on the breath that's going in and filling up all of your lungs and then going out. So either of those things you can focus on. Box breathing is called box because you're going to do the same counts for an inhalation. So a count of 4, for example. Then you're going to hold it for 4. Then you exhale for a count of 4, and then you hold it for a count of 4. Okay, so that's a little box. And when you breathe in, you can imagine the air going in through your nose, going all the way down to all parts of your lungs, the back. So imagine the air going into your back, all the way to the base of your lungs when your belly's coming out. So we're going to do that for a couple seconds. So we're going to start by inhaling, 2, 3, 4. Your belly comes out, and then you hold, 2, 3, 4. And then you exhale, 2, 3, 4. At the same time, your belly's going down. And you hold, 2, 3, 4. So we'll just do that together, a few rounds of box breathing. So inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. And I'll just let you do it a little bit on your own now. And imagine either your box or imagine your breath going in through your nose, down your throat, into all the corners of your lungs, and then out, reversing back up, out through your mouth, Let your belly drop. Okay, so that is box breathing, diaphragmatic breathing, and that's our first little tool. You can do it anywhere. I like to close my eyes because it decreases the stimulation in the world, but you can do it anytime, even when you're sitting there having a conversation with someone, although that's not being very mindful, but you can even do relaxation breathing then. And if you really, really, really want to make yourself super relaxed, you can do diaphragmatic breathing where you, instead of doing a box, when you exhale, you can exhale for a couple counts longer than the inhale. And that will increase the carbon dioxide in your blood, which naturally calms you down. And that's the way you can put yourself to sleep. So that's a little side tidbit. So I'm gonna throw it all back over to Victoria now. She's gonna teach you the other two techniques.
Thank you, Dr. Weston. That was very helpful. I needed some breathing space, so that was very nice. And I hope you're all still with me. And if you were dozing off a little bit, that's okay. You needed the break. There is not such a thing as doing these wrong or not knowing how to do them. So please don't get discouraged. Practice will make it in a way that you feel is helpful. So don't be discouraged by thinking that you can do it, that there is not such a thing. And now I'm going to bring awareness to our senses as a next way to grounding ourselves in the present moment, so that, as Dr. Weston was saying, so that we're not in the future, we're not in the past, but we're in the present. So if we're feeling distress at some point, it could be at home, maybe a lot going on at home. If you have little kids, if you have, you're at work and you're working on a deadline and you're just kind of feeling very stressed, a good way to kind of bring you to the present moment is to just use your 5 senses. You don't need any special equipment, just your senses. So I'm going to guide you through an exercise, and when I got you through it, all I would really ask you to do is to really feel into your senses. Just really pay attention to each of those senses so that you can really ground yourself in the present moment. So for now, I'm going to ask you to focus on touch. So I'm going to ask you to find 5 things that you see around. Do not read the slide if you are there. I would like you to just focus on the exercise and just look for 5 things that you have around and acknowledge them. Just acknowledge them, whether it is a pen, a spot on the ceiling, anything in your surroundings. So you're using your eyesight to ground yourself in this present moment. Just five things in your surrounding. And just label those things in your mind. Now we're going to focus on touch. I'm going to ask you to find 4 things that you can touch around you. And just really focus on how that feels to the touch. It could be your hair. Just feel how that feels to the touch. It could be a pillow. And you have nothing else, maybe it's the ground under your feet. Just feeling into your feet, feeling that touch. Now I'm going to ask you to use your hearing to pay attention to 3 things that you hear. This could be an external sound. Maybe it's internal, it's almost dinner time. Maybe your belly is rumbling a little bit. Maybe it's an internal sound. Maybe it's your heartbeat. 3 things you can hear. Now I would like for you to use your smell to acknowledge 2 things that you can smell. Anything near you. And then acknowledge, last but not least, one thing that you can taste. What does the inside of your mouth taste like? Did you just have gum? Maybe coffee? Just notice. And now you can take a deep breath in and release through your mouth or nose, whatever is comfortable, to continue to ground yourself for just one more minute. And just remember that you can use your 5 senses anytime you need them. You know, they're right there for you. You could be sitting at your desk, you could be at home. Just remember that, and you can definitely bring yourself to the present moment that way. Okay, I hope you follow that exercise and you enjoyed it. Now, the body scan is a form of meditation. It has many benefits. One of the benefits is increases our attention. It is a way to train our brain to kind of focus our attention in different parts of our body by command. It increases awareness. Whatever is happening in the mind, whatever is happening in the body scan allows you to do that. Increases embodiment, leaving our heads and living in the body. So for the first time, we're sort of paying attention to the internal processes in our body. You know, what's going on from the neck down. Letting be. Through the body scan, we're just noticing any sensations for the first time, or maybe the lack of sensations, maybe numbness, just noticing, leaning into unpleasant experiences. So as we were saying, in terms of mindfulness is not joy, right? Sometimes when we're doing a body scan, we may feel that back pain is really throbbing. Just noticing, and just noticing that back pain from the distance now. You're not suffering with that pain, but you're just sort of noticing that pain. Appreciation through contemplation. It helps us appreciate that we're not just that back pain, let's say, that you felt, that throbbing that you felt that was uncomfortable. Maybe you can contemplate that, wow, I'm feeling really relaxed in the rest of my body. It feels nice, you know? So just appreciation of other areas that maybe are doing really well and you feel content and relaxed. Getting unstuck. Observe and feel the reality that everything is always changing. So sometimes we feel very, very stuck in our body. Again, I'm talking about pain because a lot of times we get stuck in that pain. But that concept that we're not that pain, we are very fluid. We're a lot more than that. So being able to see ourselves as with fluidity, things don't last forever. So being able to appreciate that when we do our body scan, how the fluidity of our body, the sensations changing moment by moment. And now I'm going to guide you through a 3-minute body scan. So I'm going to ask you, it's only 3 minutes, to sit comfortably in your chair or wherever you are. Maybe you're laying down, maybe you're laying on your bed or on the floor. Wherever you are, that is fine. And if it's comfortable for you, you can close your eyes or leave them open, whatever is safe and comfortable for you. And I'm going to invite you to begin to bring your attention into your body. You can notice your body seated, whatever you're seated, or laying down, if that's what you're doing. And you're feeling the weight of your body on the chair that's supporting you, or on the floor if you're laying on the floor. And now take a few deep breaths as it feels comfortable for you. Any breath, breathing in and out. And as you take a deep breath, bring in more oxygen in the body. And as you exhale, have a sense of relaxing more deeply. You can notice your feet on the floor Notice the sensations of your feet touching the floor, the weight and pressure if you're laying down, the vibration, the heat, anything that you notice, just be there. You can notice your legs against the chair, the pressure, the pulsing, the heaviness, lightness maybe. The same thing if you're laying down, same sensations, just notice. Noticing your back against the chair or the floor or the bed. Just notice. Bring your attention into your stomach area. If your stomach is tense or tight, let it soften and take a breath. Noticing your hands. Are your hands tense or tight? See if you can allow them to soften. Notice your arms. Feel any sensation in your arms. And let your shoulders be soft. Now noticing your neck and your throat. Let them be soft and relax. Soften your jaw. Let your face and facial muscles be soft. And then notice your whole body present. Tuning into your whole body. And take one more deep breath. And exhale. And be aware of your whole body as best you can. Taking another breath. And when you're ready, you can gently begin to open your eyes if they were closed. Just coming back into our session. I hope you enjoy the practice. As I said before, there is not right or wrong doing. If your mind wandered to 1,000 different places while you were doing this, that's okay. That's the nature of the mind. With practice, you may find that you may focus on one part of your body for a little longer. If you notice parts of your body that were tense, that's good information for you to have so that you can work on relaxing those muscles more often throughout your day. So I hope that this is helpful practice. And again, you don't need a lot of time to do this. Again, if you're sitting at your desk, whatever you are, you can practice this quickly. And I will leave you with a
Quote.
Yes, thank you. I was totally blocking on that word. Quote from Joe Sabat-Zinn. And it says, compassion and kindness towards oneself are intrinsically woven into mindfulness. So mindfulness will help you find self-compassion and kindness. And through these practices, just by noticing them without judgment, you can find that compassion. So I hope that you can all find some mindfulness through this program. Thank you.
Thank you so much, Victoria. That was wonderful. I needed that, especially after the time change this weekend. I'm not quite functioning where I want to be. So we're finished with our section. I just wanted to just say one word, or a sentence or two. If you feel like the level of stress or anxiety or distress in your life is interfering with your functioning the way you want to function or need to function, or for example, if you scored astronomically high on the burnout quiz that we did earlier, it might be a good time to seek out some care from a mental health specialist, either a therapist or even a psychiatrist. So I wanted to leave you our practice telephone number. So for either location, you call one number, and we'll be there to help you. So thank you so much for joining us tonight. This was very enjoyable for us. And I hope that you got something out of our part of the talk. And now I believe we're going to be switching over to Nancy.
Okay, so can everybody hear me? Yeah. And
Yes.
Did the camera move to me? Because I don't see myself. Are you all seeing me?
We see you.
Oh, okay, perfect. Great. Okay, so thanks so much for the beautiful diaphragmatic breathing and the body scanning and the mindfulness. So we do a lot of that in yoga as well. And these ladies have prepped me for running you through a short chair yoga segment. So have a seat in the middle of your chair and lengthen up through your spine and come back to that diaphragmatic breath. Nice big belly breath in. And a nice long relaxing exhale. Good. And then we're going to do a series that's called Pavanmuktasana. It's just a few thousand years old. And it's an anti-arthritic series, and it's really wonderful for warming up the joints and the body. So you're going to pick up your leg and rotate the ankle about 5 times in one direction and then reverse. And spread your toes, wake up the toes. This is great to do when you're at your desk working at any time. Good. And then we're going to take the knee, we're going to draw it in to the ribs, and then we're going to open. Draw the knee in and open, in, open, one more time, and open. And then hold on to your knee, and you're going to rotate that femur bone, your thigh bone, in the socket. We're going to warm up this hip. And then reverse. And let that foot come back down to the floor. Let's pick up the other leg, and we're going to rotate that ankle. And reverse. And spread the toes wide. And we draw the knee in and stretch the leg open. Knee in and open. And one more time. Draw the knee in and rotate. And reverse that hip circle in the other direction. And go ahead and let that foot land down on the ground. Get nice and tall. Bring your hands out in front. And we're going to flex and extend the wrists. You can do it this way, or you can do it this way. And then we're going to rotate those wrists in circles. And let your fingers move and spread, open. Really good for the fingers, for that gripping, that pincer gripping. And then we're going to reverse. Good, turn your palms to the ceiling, reach them out in front of you. Tap your shoulders and open. And tap, and open, tap, and open. This time, leave your fingertips on top of your shoulders and open the arms wide, and open, and close, open, close. And the next time you close your fingertips, leave them on top of your shoulders, and we're gonna do the back stroke. So let's really warm up the shoulder. So we're getting all the joints here when we practice Pavanmuktasana. Like the Tin Man adding oil. We're oiling up and moving the joints. And let's reverse. Let's do the freestyle stroke. Bring the elbow behind you and then forward. And one more time on each side. Good. Rest your hands in your lap. Drop your chin down to your chest. Inhale, lift your nose towards the ceiling. Exhale, lower the chin. Inhale, lift. Exhale, lower. And inhale, lift. And come back to the center. Let's look over the right shoulder. Take a nice deep breath. Bring in that diaphragmatic breathing. And move your head through center. Bring it over to the other shoulder. Take a nice big belly breath. Come back to center. And this time we're just going to drop the right ear over top of the shoulder. Take a nice stretch along the side of the neck. Nice big belly breath. And lift your head up and over and lower the other ear to the other shoulder. Take a nice deep breath. And back to center. Good. Let's inhale, bring those arms out wide. Tap your fingertips together. If you can, look up to the fingertips if your neck is happy today. And exhale, release, press the air away. And inhale, imagine you're bringing your fingers through molasses. Nice and slow, reach wide. Tap those fingertips together and exhale, release. Great, let's do that one more time. Inhale, lift up. Tap the fingertips together. And this time we're going to fold forward. So we're going to bring our belly to our thighs. We're going to let our hands come to our ankles and we're going to gently roll the neck down. And just let your head relax and release. And then inhale, reach those arms out wide. We're going to go back the same way we came. And we'll do that again. So they call this swan dive down. Fold at the waist, bring your belly to your lap. Hands come to the ankle. Lower your head. And then inhale, look up. Bring those arms out wide and reverse swan dive. Let's do that one more time. Exhale, forward fold. Inhale, look up and reverse swan dive. Bring your palms together and draw them right to the center of your heart. Take another deep belly breath. Good. We're going to open up this right leg and we're going to let the left leg drop down. So hopefully you're in a chair where if you have arms, it makes it a little bit difficult. But if you've got a nice square chair without any arms, this should work well for you. Good, let's drop this left leg down. Great. We're gonna inhale, reach those arms up and look to the wall to the side. So your ribs and your hips are facing the same as your knee that's in front of you. Take a nice deep breath. And then go ahead and bring your right arm to the left knee. Bring your left arm to the back of the right thigh. And take a nice easy twist. Maybe you can bring your chin to your back shoulder. Let's take 2 or 3 deep breaths. And then bring those arms back wide. Release that gentle twist. Look forward in front of your knee. Take a breath. And bring your hands back down to the chair. Good. We'll turn to the other side. Let your left knee come off the side of the chair and let the right knee hang down. Inhale, bring the arms up. And let's take a few breaths. And bring your right arm to your left knee. Let your left arm come behind you for a nice twist. And by the way, you can twist in both directions here if you want to bring the front arm with the front knee. So either way you decide to twist, whatever feels good. Just go nice and easy on yourself. So it's a self-care. And then scoop that air back up. And face the front knee, take another breath. And release the hands back down and come to center. Great. Let's bring our left foot up in front of the right knee, and then let your knee drop down. Take a nice deep breath. Feel into the hip. Just notice what you feel. And let's take a few more breaths. If you want to feel a little more, don't push or press, but if you want to feel a little more, you can just gently fold forward, and you're going to feel a little bit more intensity there in that hip. Let your hands rest on your leg. Maybe fold a little deeper just for another breath or two. No pushing or pulling, just releasing into the stretch. And then bring yourself back up. Release that leg. And let's take the right leg, bring the right ankle above the left knee, and let that knee gently drop down. Take a few breaths and just notice each hip feels different. Coming into the mindfulness practice and the awareness, notice what you feel. Notice the sensations. At the Kripalu Institute, where I did my first training program, they have a saying: breathe, relax, feel, watch, and allow. And maybe you fold a little bit forward just to really feel into that hip, noticing and breathing. And let's take 2 more deep belly breaths. And then inhale, come back up. We're going to bring our hand to grab a hold of or press it into a sofa wherever you are. Bring that left hand down, hook it or press it into something. Let's reach the right arm up and over for a nice side body bend. Take a few deep breaths in. And release that upper arm, grab a hold of the side of the chair or press it into something secure. Your right hand, let's reach the left arm up and over. And take in a few of those diaphragmatic breaths. Feel the rib cage expand as you inhale. And on the exhale, feel the ribs soften and release. And one more breath. And we come back to center. And I think I probably need to wrap things up here. Let's bring our hands to our heart center. And we're just going to press the hands up, sweep the arms around. We'll do that 2 more times. Palms come together, press up, and sweep around 1 more time. And exhale, bring your palms to your heart center. And let's take a nice big breath together. And in yoga, we say namaste when we finish our time together. And that means the light in me honors the light in you. And we bow, namaste. Thank you so much for practicing a little bit of chair yoga with me. That's just a little sample. I'll turn the program back over to the other hosts.
Thank you, Nancy, and thank you to all the speakers. We have some time for questions. You can either ask them or type them in the chat box. And also, before you leave the program, we've put the evaluation in on the chat box that we ask that you do that. And also the link that if you want to see this video, you can do that in about a week. So if anybody has any questions, feel free to ask them. There's another question in the chat box. I'll read it. Can you share whether or how you have incorporated these experimental tools into a therapy session?
Yes, so I'll answer that. It's part really of the skills and all the tool set that a therapist may typically provide to someone that comes in for psychotherapy. Some people don't feel comfortable with this type of practices. They don't feel it's right for them. So it's really depending on the goal that the person has coming into psychotherapy. But it certainly is part of the training that you can provide people in therapy so that they can, you do it in the session, you practice it in the session, you process what that was like for you, and then you kind of are able to go home and practice in between sessions so that you can come back and continue to build on the practice. And again, it is a very individual choice, and it really depends on the person's goals for psychotherapy when they come in. And it's a mindfulness-based type of approach in therapy, so that if you're looking for this type of interventions, if you're looking for a therapist, you can, and you're looking for qualifications, you want to find someone that has been trained on mindfulness-based CBT, cognitive behavioral therapy interventions.
Okay.
I hope that answered the question.
Okay, thank you. Another question, will the chair yoga video be part of the recording? Yes, we've recorded everything, so we're still recording, so it'll be there. Does Nancy do any non-chair yoga classes, and if so, where?
So I responded to that. This is Nancy. I
Okay.
teach a couple of classes at Capitol Health. I teach a breast cancer class. I teach restorative yoga, and I teach other classes. If you'd be interested, you can find me on my website. I put it up on the chat room.